You ready? All right, good afternoon. I'm Dr. Angela Dunn, the state epidemiologist for the Utah Department of Health. We are up to 1,675 COVID-19 cases in Utah. That's an increase of 70 from yesterday. It's important to not focus on individual daily numbers at this point in the outbreak and really focus on the trends over the past couple weeks. The low number reported yesterday is likely a reflection of low testing over the weekend. We have tested 33,394 people in Utah for COVID-19. That's an increase of just over 2,500. And a lot of these numbers include the negatives that we have gotten in that were taken on Thursday or Friday of last week. We still hold steady at a 5% positive rate of all tests done in Utah. Unfortunately, we are up to 13 deaths in Utah right now. That's an increase of 5 from yesterday. One of these people is an individual who was hospitalized at the time of death. It's an older adult, less than age 60. 2 are from a long-term care facility outbreak that we're investigating with Salt Lake City. Part of this outbreak, we identified 23 residents of the long-term care facility who are positive for COVID-19 and 2 staff. There were 10 residents who were negative for COVID-19, and they've been transferred to a sister facility. They're housed in a separate wing of this new facility and are cared for by dedicated staff. The other 2 deaths were in a long-term care facility in Utah County, and we're working with Utah County to do a full investigation of this outbreak. All right, with that, I will open it up for questions.
When it comes to the projections of death from what people were, my boss was asking, modeling shows a big reduction in expected deaths in Utah. Is that true, or what's the situation with that?
Sure. So the question is, some models show a drastic reduction in the number of deaths for Utah?
Lower projection.
Lower projection?
Something like that.
And so we are fortunate in Utah that we have held steady at a less than 10% hospitalization rate, and our death rate has also been low. A lot of that has to do with our younger population here. So we have a large percentage of our population that's less than age 65 years, so we have less risk for severe outcomes due to COVID-19. However, we're always preparing for worst case scenario in case those projections don't hold true, that we will be prepared for the excess care that's needed if there is a surge on our hospital systems. On the phone? Any questions from the phone?
I think I have a question. Can you hear me?
Oh, I can hear you now. Go ahead.
Okay, good. This is Jed Bowl from KSLCB.
Sure.
I was going to ask another question with regards to that modeling out of Washington University, or the University of Washington. And it shows a drop in the number of days that we will have a spike in deaths. To what extent does that modeling help you in terms of your planning? And is the state doing any of its own modeling for those kinds of projections?
Hey, before Angela answers that, if we could, if you're not speaking, if you're not answering a question, if you could mute yourself, just so everybody else can hear the questions, that would be helpful. Thanks. Sorry, Angela, go ahead.
That's okay. So the question is about the University of Washington model. How are we using that in our own planning, and do we have our own models in Utah? So the University of Washington model uses Utah-specific data to estimate peak number of cases in relation to our hospital beds, ICU beds, and even mortality rates. And it is showing that we will have enough healthcare capacity to care for the predicted number of individuals who need hospitalization due to COVID-19. However, like I said before, we're always preparing for worst case scenarios, so we are actively planning for what we would do if there is a surge on our healthcare systems to ensure that those who need medical care can get it. So we're hopeful that those predictions hold true, but we're preparing for the case that they might not be. And with regards to Utah models, we are working directly with the University of Utah to do more specific models for Utah in terms of our planning and how we think that this outbreak is going in the state of Utah.
And this is Nick McGurk from ABC4. I know that last week you talked about modeling. Projections showed Utah hitting its peak in late April. Is that still our guess, or when is our projected peak?
Yeah, so our projected peak by the models that are out there still show Utah peaking at the end of April. And so that's kind of where we're still on trend. However, these are all models, and so the daily case counts and the more data we put into these models, the more accurate they will be, and they are likely to change over the coming weeks as well. So we'll keep you updated on those changes.
And the U.S. Surgeon General has really, oh, sorry.
Go ahead with the follow-up question.
Yeah. So yeah, just the U.S. Surgeon General had some really dire words about this upcoming week, saying that the remaining 10 states that don't have stay-at-home orders, they really urged those states to put those stay-at-home orders in place. It's my understanding that we have a stay safe, stay home directive, but not an order. So in relation to what the U.S. Surgeon General said, are we changing our mindset here in the state? Do you have any more recommendations for the governor? Kind of just general comment on his remarks yesterday.
So the question is about the stay-at-home order and if we're planning on doing an order in the state versus a directive. So we are constantly updating Governor Herbert with the latest data and recommendations. And if he chooses to make changes in the directive and make it an order, he will certainly update us all. However, the stay-at-home directive is expected to be followed by everybody in Utah. And so we are expecting everybody stay at home and only leave for critical services and maintain social distancing for the coming weeks and potentially months. Next question.
Dr. John, are you Dr. Dunn, can you hear me? This is
Yes.
Ben Winslow with Fox 13. Are you anticipating that the stay-at-home orders that are in place by local health departments will extend beyond your peak projection at the end of April? Will this go into May, possibly June?
So the question is, how long will stay-at-home orders be in place? That, of course, is up to the decision of our local health districts and then the governor's office for any statewide orders. It is important to know, though, that once we start seeing a decline in cases, it's important to maintain social distancing restrictions until we see a significant decrease in cases. If we lift restrictions too early, we do risk seeing a resurgence in cases. So that timing of when to lift restrictions is essential.
Hi, Dr. Dunn. Ashley Inley.
Sure, go ahead.
With Deseret News. What can you tell us about the person who died who wasn't in a long-term care facility?
Sure. So the one death we're reporting today passed away in a hospital and did have underlying medical conditions. He is an older adult, but younger than the age of 60 years. That's all the information I have on him.
Do you know where he was from or what county?
Oh, yes, Salt Lake County. Thank you for that.
Thank you.
Dr. Dunn, can you clarify the hydroxychloroquine situation here in Utah? Is it available? Is it being prescribed? There was some confusion over the weekend about whether the state was controlling distribution of that drug.
Sure. So the question is about hydroxychloroquine with relation to treatment of COVID-19 individuals. So our position is the same as it has been from day one of this outbreak. We have made zero moves to try to, control any access to hydroxychloroquine or chloroquine. If a provider chooses to treat his or her patient with hydroxychloroquine or chloroquine, they are okay to do so. The state of Utah doesn't interfere with that relationship at all.
There is one guy who
The
tweeted.
federal government says that they're
I'll go to you next.
stockpiling chloroquine and hydroxychloroquine. Are you hearing of any shortages of people not being able to obtain it?
So the question is, have we heard of shortages of hydroxychloroquine or chloroquine? So both of those drugs are used for things outside of COVID-19, such as lupus and other autoimmune disorders. And we have heard of national shortages of those patients having trouble getting their hydroxychloroquine and chloroquine. However, we don't have any reports locally of that, but that has been reported nationally. Go ahead in the room.
Doctor who did tweet out, said, I tried to prescribe it, and the state has taken over. But I mean,
Interesting.
Was there just miscommunication there, or?
Yeah, so the question is, there was one provider who reported that they weren't able to prescribe it because the state has taken over. And yeah, that's a miscommunication. That's not true. Yeah. Other question from the phone? Yep, go ahead.
Hi. Now, the two new deaths in Utah County, were they at the same nursing home?
Yes, so they are associated with the same nursing home, and in that nursing home we identified one additional positive patient and are working to do a more extensive investigation right now.
Okay, how many people live there?
I'm not sure right now how many people live in that particular nursing home in Utah County.
Can you give us the ages of the 4 other deaths?
Yep.
The 2 at the Salt Lake City nursing home and the 2 at the Utah County nursing home?
Sure. So the 4 deaths we're reporting today that are associated with long-term care facilities are all over the age of 60 and all had significant underlying medical conditions.
Apologize. Dr. Dunn, can you speak to how rural hospitals, particularly in southern Utah and in other parts of the state that may not have access to more medical supplies or other things, how are they faring in terms of testing numbers, in terms of medical supplies? Do you have any thoughts on that?
Sure. So the question is about how are rural settings faring in terms of medical supplies and testing capacity. So in terms of testing capacity, we are working with healthcare systems and then also leading up some efforts here with the Department of Health in order to expand testing to those rural areas. We are considering mobile options and also setting up kind of temporary options at the rural hospitals. With regards to medical supplies, we have packets of personal protective equipment that are going out to all healthcare systems, and the rurals are included in that. So they're getting kind of the same effort of supplies and PPE that the Wasatch Front hospitals are getting as well.
And then in regards to a potential mobile options, is there any kind of timeline for when that might roll out?
So we're working at rolling out a couple of kind of pop-up testing sites in rural counties this week. We're focusing first initially on the counties surrounding Summit County because that was a huge hotspot, and we want to make sure that we're identifying any bleeding into the other local counties. And then we'll be working with some other hotspot areas that have had low testing in the rural setting by the end of this week as well.
With the death that was reported today, that additional 5, which days were those? How much is the lag time between somebody dying and that death appearing?
Sure.
In our count?
So the question is, what is the lag time on death kind of happening and being reported to us? So that can vary because if people pass away in a healthcare system, that it's on the hospital to notify the health jurisdiction or the Utah Department of Health of the death. All of the patients we're reporting today did pass away on Saturday.
And are people being tested posthumously if they were displaying symptoms but didn't get a test?
So that is an option. So the question is, can you test people for COVID-19 post-mortem? And we do have that option. We have not had to use it yet. We haven't, I should rephrase that. We have not identified anybody as having COVID-19 after their death. However, it is an option, and it's something that we have the ability to do.
Okay. And can you tell us whether Navajo Nation cases in Utah are counted in our totals, both for just confirmed cases and hospitalizations as well as deaths?
Sure. So the question is about individuals living in Navajo Nation. Are they counted in our system? If they are Utah residents and living in Utah, they are counted within our surveillance system, and we work with them on those investigations as much as they need us to as well. Go ahead in the room.
Do we know why the...
Just a quick follow-up.
Let her follow up.
Okay, the follow-up, and then we'll go to the room.
Sorry. Just a quick follow-up on the hotspot counties you mentioned reaching out to. Are there any counties in southern Utah that will be targeted this week for that?
Yeah, so we're working directly with Southwest Local Health District, where St. George is, to ensure that they have the testing capacity they need to be able to identify those with COVID-19. Okay, go ahead in the room.
Do we know why the University of Washington did bring down the number of projected deaths? Is that just
Sure.
social distancing, or why?
Yeah, so the question is, why did the University of Washington model bring down the projected number of deaths? So they update that based on our case counts. So we're still showing a relatively low rate of growth in our case counts every day. And by maintaining that low growth, we're not seeing an exponential growth that is expected. And so because of that, our predicted deaths are low. So that changes based on the data that comes in daily.
Question on the phone?
Dr. Duff.
Yeah, it looks like since the second, we've seen just based on the graph that you have on your website, we've seen a decrease in the number of test results at least. Are we testing fewer people each day, or is that just product of reporting? And if we are testing less people each day, why is that?
So the question is kind of how many people are we testing every day, and are we seeing a decrease? We're still holding steady at about the high 2,000s to low 3,000s every day, and that's what we're expecting and anticipating. The graph on the website does have a slight delay in the last 3 days of testing because our negative test results come in about 72 hours after the resulted. We get the positive results generally between 24 and 48 hours, but there is that lag in the negative results. So as the next few days pass, we'll see a filling in of that curve.
I understand that the Utah Department of Health has received a complaint about non-essential Salt Lake County aging services and possible COVID transmission vectors. Can you comment on that?
No, so the question is, have we heard about a complaint with Salt Lake Aging Services? And I'm not aware of that, no.
I had a follow-up on my testing question. What is the state's current daily capacity for testing, and are we maxing that out in the number of tests that we're doing?
Sure, so the question is, what is our current capacity as a state? You know, I think it's somewhere around 4,000, 4,500 at this point, so we still have room to expand if more people have symptoms and need to get tested. However, that's the lab capacity. There's moving pieces within the idea of how many people can get tested every day. And right now we're seeing a shortage in the swabs that are required to actually conduct the test. And so it feels like, you know, we solved the testing capacity and now we have to look at the supply capacity. And so we're always kind of playing that game of how many people should get tested and how much supplies do we have, based on how many people need to be tested and who is that vulnerable population that should be prioritized.
All right. So do you have a number on the testing capacity in terms of supplies, or just the testing capacity in terms of what the lab can handle?
So about 4,000 is what a lab can handle. Our various healthcare systems have their own supplies of viral media and swabs, and right now we're looking at about 1 to 2 week supply for those things overall.
Do we know which Utah hospitals participated?
Go ahead.
So what is the testing capacity with not in terms of the lab, but in terms of the supplies? Do you know on a statewide level?
Yeah, so if we were to continue testing at this rate, we'd have supplies for about another week. But we have ordered additional swabs and viral media and are looking at alternative methods for those supplies to ensure that we continuously have the capacity to test. So those plans are in the works, but we just don't have those supplies in hand right now.
Okay, so you're keeping...
Do we know which Utah hospitals participated?
Go ahead, which Utah hospitals what?
Sorry, I was just trying to get one more question in.
Go ahead.
Do you know which Utah hospitals participated in the U.S. Health Department's Office of Inspector General hospital experiences responding to COVID-19 pandemic national pulse survey?
No, so the question is, am I aware of which hospitals in Utah were part of a national survey on COVID-19? And no, I'm not aware of which hospitals participated in that, sorry.
Do you have a sense that most, if all did, or that?
Yeah, I don't have any visibility on that.
Dr. Dunn, I have one more question about testing to kind of follow up. Can you tell us more about the pop-up testing that is expected for Summit County, like you just mentioned? Yeah. And then talk more about the process of testing and requirements. I'm wondering if it kind of depends on where you get it done, what those qualifications are, and whether the test costs money. Does that kind of vary from, hospital to hospital?
Okay, sure. So our alternative specimen collection sites that we're looking to expand across the state is a partnership between the University of Utah, Intermountain, and also testutah.com. So we're working together to identify which geographic areas could benefit most from these alternative specimen collection sites and get those set up this week. The other question is about kind of criteria for testing. So we have worked directly with Intermountain, ARUP, and the University of Utah to determine criteria and statewide priorities for testing, and that includes people who are symptomatic, and they might be healthcare workers, first responders, living in a congregate setting or long-term care facility, or have had a clear exposure to someone with COVID-19. But something we're really clear on is right now with our testing capacity and with what we understand about the test, we recommend only those with symptoms symptoms get tested. So that's where we are at a state. We expect that any Utahn who goes to any site to get tested, that criteria will be followed. In terms of payment, I'm not sure what the private labs are charging for payment. I do know that if the specimen is sent to the Utah Public Health Laboratory, it is free to the patient.
For the number of hospitalizations that are reported on the state's coronavirus website, is that everyone who has been hospitalized throughout this outbreak, or is it just the people who are currently in the hospital?
No, so the number of hospitalizations on our website is total hospitalized throughout this outbreak.
This is Brittany with ABC4. Dr. Dunn, on Friday you mentioned that tests are coming back with false negatives and false positives. Can you expand on that and answer how accurate are these COVID-19 tests, and do you have numbers as to how many tests in Utah have come up with a false negative or false positive?
So with the test that is run through our Utah Public Health Laboratory and ARUP and the labs, University of Utah and Intermountain, the labs in Utah, we are confident in its ability to detect disease. We take every positive as a true positive and every negative as a true negative. So there isn't any consideration there. When we start testing asymptomatic populations, that's when the reliability of the test starts to decrease a little bit. So we are recommending that symptomatic patients get tested. Okay, one more question.
How much does that,
So the question is,
reliability decrease?
So the question is, how much does the reliability decrease? And, you know, that's something that nationally we are working to identify. We just need bigger numbers and understanding of everybody who has contracted the disease to really get those specific numbers about the lab test. Okay, go ahead, Jenny.
I'm sorry, I also have a follow-up, Dr. Dunn, to my question.
Sure.
So are you recommending that people that don't have symptoms don't go get tested because there could be a false test for that?
Correct.
Because on Friday, the governor was saying anybody who has come in contact with anyone who has COVID-19 but doesn't have symptoms should still be tested as well.
Yeah, I'll just clarify that. So we do recommend that if you've had close contact with a COVID-19 individual and you have symptoms consistent with COVID-19, you should get tested. We are not recommending testing for asymptomatic individuals at this point in the outbreak.
and kind of as a
Dr. John,
One final question in the room here.
Capitol News Service. Just checking with you on any kind of positive developments in antibody research. Do you have any view on that or any kind of handle on what's going on that might be encouraging? We're seeing some trending in Australia, for instance. It looks like they may be bending their curve downward. Do you have any encouraging thoughts?
Sure, so the question is about antibody. So what's really important is when somebody survives any virus, but COVID-19 specifically, their body builds up antibodies which fights off the virus. Right now, Red Cross has an initiative for everybody who has survived COVID-19. If they would like to, they can donate their serum that could be used for treatment of individuals suffering severe disease from COVID-19. So if you go on the Red Cross website, you can find information about that. And if you've survived COVID-19, they might be able to accept your serum for treatment of those who have severe disease. The other piece of antibodies is the testing piece. So can we identify if somebody has built up antibodies and if they are immune? Those discussions are very early on in understanding the immune response to COVID-19. So we're looking at that as a state, but also nationally. Okay, last question in the room.
Okay, so it's kind of a follow-up to testing. We've been hearing that there's some confusion amongst the public when they're getting a phone call, not knowing if it is truly the Utah Department of Health or their local health department calling about an exposure they may have had. So can you just clarify to somebody when, if I were to get a phone call, how do I know that it's real or not? And the importance of calling public health back if you have had contact.
So the question is, how do people know that it's actually public health calling them when they're reaching out? So as we're getting more cases in Utah, we're going to be contacting more people because we have more people having close contact with positive cases. This is a big effort by public health, and the way we typically reach out to people is by a phone call or a text. So it is important that you call us back if we do leave a message or a text. I want you to know, though, that we will never ask for any financial information, we will never ask for your social security number, and we will certainly never ask for money. So if any of those three things are happening, it is a scam. You shouldn't give them any information. But public health will be reaching out to people by phone call or text to see if they are a contact and what symptoms they have. Okay, thank you guys so much. See you tomorrow.
Can you take one more question? Hello?
Sure, go ahead. I'm a sucker, I know.
Could you discuss a bit why the state took over operations at that one Salt Lake City nursing home with the outbreak? Certain missteps that contributed to that they can't take care of the patients?
Sure, so the question is kind of what is the state's role in the long-term care facility outbreak? So we have a team here of healthcare-associated infection specialists, and we work collaboratively with the local health departments on all these outbreaks, COVID-19 related and not. So it's a collaborative process bringing experts from the local and the state health departments together to identify and prevent as much disease as possible. Okay, thank you guys.
Other steps other facilities should be taking?
Sorry, folks.